Hello, dearie. How are you doing? I hope you're doing wonderfully well. So earlier this year, I promised I was going to do a series on the types of nurses that we have, especially from the basic programs. So general nursing, public health, midwifery, and mental health nursing. And so in today's video, we are going to talk about registered general nurses, who they are, what they do, how you can become a registered general nurse, and places they can work, and some of the benefits that comes with being a registered general nurse. So if you're interested in registered general nursing, let's dive right in and you may learn a thing about registered general nurses. So a registered general nurse is a healthcare professional who provides professional nursing care to patients of all ages by contributing to the assessment, planning, implementation, and evaluation of patient care to improve health outcomes. You know, when you hear nursing and you're like, oh, I want to be a nurse to take care of patients, that patients you mentioned, people who are sick, it means you are gearing towards registered general nursing, at least here in Ghana. Okay, so they are the curative nurses or the care-centered nurses. They are what other countries will call bedside nurses or medical surgical nurses. They are part of the health team, so the doctor will determine what plan of care will be given to this patient based on their condition, and then the nurse will follow through with that care. You will be there to administer the medications that will be prescribed for this patient and attend to their needs. You do their assessments on day-to-day basis to monitor the progress of the patient, whether the patient is improving or not improving. You take notes and let the doctor know that, okay, this patient, this is how far we are with the patient, because you will spend the most time with the patient. The doctor will come in the morning, do their rounds, and go. But the whole of your shifts as a registered general nurse, you will be with that patient, giving him or her everything they need to make their stay in the hospital comfortable. Okay, so yeah, that is who a registered general nurse is. So if you are thinking about a registered general nurse, just think about what your mother does when you are sick, you know, care for you, bathe you, feed you, help you poop if you are not able to go to the washroom to poop. If you poop yourself, she will clean you up, and all of that done to you by somebody else who is trained in the hospital. They care for you like your mother will, except that they have advanced medical knowledge to also look at you and see what is going on in your body. They know how to interpret your vital signs and all of that. Okay? Now, how do you become a registered general nurse? In Ghana, we have two types of registered general nursing programs. We have BSc nursing and then diploma registered general nursing. With the diploma level, you train for 3 years. You train for 3 years and do your internship, 1 year internship, where you do your rotation in all the other fields and gain some experience in those fields and master your skills. Then you can start working. You get your license and you start working. If you want to do the degree level program, you do the university's BSc nursing program for 4 years and do your internship for 1 year, making 5 years, and then you are ready to start working. The only thing you have to take in consideration is that the school should be accredited by the Nursing and Midwifery Council. If you apply to a public nursing training college, they are already accredited by NMC. If you apply to a university, a public university, they are already accredited by NMC. But if you want a private nursing school, then you have to make sure that they are accredited by the NMC, because NMC is the only regulatory body in Ghana that can give you a license to practice as a nurse. So if you go to a school, so if you do your program in a school that is not accredited by NMC, you may have your academic certificate, but you will not have the license to practice. Okay, so that is the difference. Now, where can they work? As a registered general nurse, you can work in various settings because their work is care centered. Anywhere sick people go, from the crown of their head to the sole of their feet, you can find a registered general nurse there. You find them at the OPDs, That's the outpatient department. They are the first group of health professionals you meet that starts your care by taking your vital signs, triaging, selecting patients that are more sick than the others. So in the hospital, it's not first come first serve, it's first to die first serve. Okay, so that is what triaging is. They can also work on the wards, on the various wards in the hospital, depending on the types of wards they have. So from the emergency ward to medical ward, surgical wards, the theater, the operating room, the ICU, that's the intensive care unit, PDs, the pediatric ward, obs and gynae ward. Anywhere sick people are, you find registered general nurses there. And in the hospital setting, you can also find them in health centers. In Ghana now, registered general nurses don't work as the chief zones, so you will not find a registered general nurse at the chief zone, but you can find them from the health centers to the polyclinics to the district hospitals and tertiary hospitals, teaching hospitals, and the like. Okay, outside the hospital setting, you can find them in schools. They can also work as school nurses. So in Ghana, the Ghana Health Service and the Ghana Education Service have a memorandum of understanding where the GES will build infirmaries, school infirmaries, and Ghana Health Service will put nurses there to attend to the health of the students, and mostly is the RGNs, the registered general nurses, that are posted to those school infirmaries to take care of the students. So you can also work in school infirmaries. You can work with NGOs on various projects. You can travel outside and work. Okay, yeah. So what are some of the benefits of being a registered general nurse? Per your training, if you become a registered general nurse, we call you a general nurse because you are trained to deliver care to the sick from the crown of their head, from the crown of their head to the soles of their feet, for different age groups and sexes. There are a lot of specialties that you can zone in on, you can specialize in. So when it comes to specialization, a general nurse has a lot of opportunities, you can just specialize. If you look at the specialty programs that we have in the country, general nurses are eligible to apply to about 80%, if not 90% of them. Okay, you can do anything. You can become a critical care nurse, perioperative nurse, palliative care, oncology, ophthalmology, ophthalmic nursing, ENT, dental, all of it. You just have access to all the specialties, let me just put it that way. So you are not limited in career growth. You always have a place to move in. You just need to have a passion, or you just need to choose what you want to do, and the road is your front. Okay, another benefit of being a registered general nurse is that bedside nursing is always in high demand. Yes, everywhere in the world people fall sick, and everywhere in the world a nurse is needed. So anywhere you find yourself in the world, you are guaranteed a job. So far as you are licensed, you have the right education, you are guaranteed a job in that country. Unless we all die, like when the zombie apocalypse happens. I watch too much movies, so that is when we'll stop needing nurses. Even that, we'll still need nurses, because you still need to nurse the surviving people. So you will always be needed somewhere. Okay? Yes. Another opportunity of being a general nurse is the fact that if you work in the hospital, you run the shift system. So you in Ghana, we have the morning, afternoon, night shifts, and that can give you the opportunity to pick up extra shifts in different facilities, in private facilities. So it gives you a higher earning potential, because for someone like me, I'm a public health nurse. I have to work Monday to Friday, morning to evening, 9 to 5 or 8 to 5. Ghana is 8 to 5. 8 to 5. Okay? So I can't close from work at 5 and go and do night shift somewhere, and the next day I have to go to work again. Now die, I go die. But if you are a registered general nurse, you have morning, you close in the afternoon, you get your days off, you can go and work somewhere else and get extra money. Outside the country, in places like the USA, they work 12-hour shifts 3 days a week. So you work 3 days a week and you have 4 days off. You can choose to work 2 extra days in those 4 days and earn more money. So your earning potential is higher than for those who work 9 to 5. So those are some of the benefits of being a registered general nurse. It's a very good program. Normally when I meet applicants who are like, oh, Nurse Alase, I don't know what to do, I don't know where I want to be and all of that, I just say, if you don't know what to do, you just do registered general nursing, because that way you don't restrict yourself. If you know what you want, you can go and do programs like midwifery, mental health nursing, public health nurses, because they are more specialized and focused in specific areas. And so sometimes you can be restricted a little with those programs. So if you don't know what you want to do, just do registered general nursing and take it from there. In the future, when you change your mind and you're like, oh, I should have done public health nursing, you can just go to public health nursing school. Or I should have done mental health nursing, you can just go to mental health nursing school. Or you can just go to midwifery, or you can just specialize and you move on from there. You are not restricted in any way. Okay, so yeah, that's what I have for you. If you want to know more, just leave questions in the comment section and I'll answer it. Sometimes people ask what is the difference between a diploma holding general nurse and a degree holding general nurse. If you click this video, I talk about that briefly and you see the clarity there. So click on it and I'll see you there. I hope this video was helpful. Like, share, subscribe if you've not done that yet, and I'll see you in this one. Bye. If you look at or if you look at the specialists, if you look at the specialized, if you look at the special